Sure. So readmittance rates are very high with ABSSSI, and like I mentioned before, it's mostly because I believe we have to change the algorithm of how we're treating them. The indirect costs of these patients getting admitted for 7 days of treatment, 5 days of treatment, usually because of them having failed oral antibiotics, is a lot more than they're at risk for other hospital-acquired infections. Cost is a great aspect for both the patient as well as the healthcare institution, and then like just some direct costs as well of just length of stay, duration of therapy, just all the things kind of come together to really make us look at our readmittance rate, and maybe changing, like I said, having another place for these patients to go to get identified and treated appropriately, and then setting them up for success afterwards and educating them like, hey, this is going to last for 14 days, for example, for dalbavancin, and like really making sure we identify that specific patient. Now, this doesn't mean that it's for everybody, but really trying to create more and more protocols to see like how can we better identify these patients. The other thing is the access to these agents is quite difficult in the inpatient setting. It's used as more with 340p pricing and everything else. It's in the outpatient setting, but getting access, for example, I've had it be used in a patient in the inpatient setting, and I had to fax 3 different things, get them on the phone and be like, hey, we need a 24-hour turnaround, really need you guys to look at this patient, so the insurance and everything else and the copay. So making sure that legwork is a little bit easier on everybody to make sure we get the patient the best care possible as soon as possible with that. And then the other thing I thought about was, and this is a new buzzword right now, is the outpatient stewardship. This is a great aspect, like ABSSSI in general is a great aspect that outpatient stewardship can help with, really identifying those patients in the clinic settings and the outpatient, other outpatient settings, and aiding with them in drug acquisition, prices, and algorithms and education. Like that's a really good thing that the outpatient stewards can help with.